Hello everyone and welcome back. My name is Dr. Ben Osevwe, DNP-PMHNP. Today we are talking about Lamotrigine, also known by the brand name Lamictal. Before we get started, remember that this education is for learning purposes only. It does not replace medical advice, diagnosis, or treatment from your healthcare provider. Please do not start, stop, or change any medication without speaking with your prescriber. Alright, let's talk about Lamictal. And don't worry, we are going to keep this simple. We are not here to wrestle with a neurology textbook, a psychiatry textbook, and a dermatology textbook all at the same time. We are here to understand the medication in a way that patients, families, students, and providers can actually use. No unnecessary big words, no medication gymnastics, just clear education with a little fun. What is Lamotrigine? Lamotrigine is a medication often used as a mood stabilizer and anticonvulsant. It is also known by the brand name Lamictal. It was originally developed as an anti-seizure medication, but in psychiatry, it is commonly used for bipolar disorder, especially to help reduce the risk of future depressive episodes. In simple terms, Lamotrigine helps calm unstable mood patterns over time, especially when depression keeps coming back in bipolar disorder. It is not an antidepressant, it is not an antipsychotic, it is not a benzodiazepine, it is not a rescue medication. Lamotrigine is more like a mood-stabilizing seatbelt. It does not drive the car for you, but it helps reduce the emotional crash risk when mood symptoms start swerving all over the road. What is Lamotrigine used for? Lamotrigine is commonly used for bipolar disorder, maintenance treatment, and bipolar depression prevention. It is also used for seizure disorders like focal seizures, generalized tonic-clonic seizures, and Lennox-Gastaut syndrome. It may also be used off-label in some patients with treatment-resistant depression, mood instability, or emotional reactivity depending on the provider's clinical judgment. In psychiatry, Lamotrigine is especially known for its role in bipolar disorder, particularly when depressive episodes are a major concern. This is important because many people think bipolar disorder is only about mania. But for many patients, the depressive side is what causes the most suffering. They may say, "I crash into depression more often than I get manic. My mood drops keep coming back. I do not want to feel emotionally unstable. I need something that helps prevent the lows." Lamotrigine may be considered in those situations. But here is an important teaching point. Lamotrigine is not usually the strongest option for acute mania. If someone is currently manic, not sleeping, impulsive, highly energized, spending excessively, grandiose, or psychotic, Lamotrigine is usually not the emergency brake. It is more of a long-term stabilizing tool. It is not the firefighter rushing into the building. It is the fire prevention plan. Mechanism of action. How Lamotrigine works in the brain. Let's go a little deeper, but still keep it simple. Your brain cells are called neurons. Neurons communicate with each other through electrical signals and chemical messengers called neurotransmitters. In the brain, some signals are calming, and some signals are excitatory. Excitatory signals tell brain cells to fire and send messages. That is not bad. But when signaling becomes too unstable, it can contribute to seizures and mood swings. Lamotrigine affects voltage-sensitive sodium channels in neurons. Sodium channels help neurons fire electrical signals. Lamotrigine helps reduce excessive firing and the release of glutamate. Glutamate is one of the brain's main go chemical messengers. Lamotrigine helps calm excessive electrical and chemical signaling in the brain. Think of the brain like a group chat. Sometimes the brain group chat is helpful. One neuron says, let's focus. Another says, let's regulate mood. But sometimes the group chat gets too loud. Glutamate comes in typing in all caps. Everybody panic. Send 47 notifications. No one sleep. Mood swing incoming. Lamotrigine does not delete the group chat. It simply helps reduce the excessive noise. Lamotrigine is like putting the brain's notification settings on reasonable, not silent, not chaos, reasonable. In mood disorders, especially bipolar disorder, the brain may have patterns of unstable mood cycling. Lamotrigine may help reduce the likelihood of future depressive episodes. It is often valued because it is usually less sedating than many other mood stabilizers and has a lower risk of weight gain compared with some alternatives. But that does not mean it is risk-free. Lamotrigine comes with one major safety conversation, the rash conversation, and we are going to spend time on that. Now let's talk about the serious warning. Lamotrigine can cause serious skin reactions, including Stevens-Johnson syndrome, also called SJS, and toxic epidermal necrolysis, or TEN. These reactions are rare, but they can be life-threatening. This is why lamotrigine must be started low and increased slowly. We do not rush lamotrigine. Lamotrigine is not a microwave medication. It is a slow cooker medication. If you rush it, you can create serious problems. Stevens-Johnson syndrome is a severe reaction where the immune system has a dangerous reaction and the skin can become inflamed, painful, blistered, or start peeling. This is not a regular mild rash. This is not, I changed laundry detergent and my arm is itchy. SJS can be serious and requires urgent medical attention. Patients should contact their provider right away if they develop any rash, especially during the first 2 to 8 weeks of treatment or after a dose increase. A concerning rash may include rash with fever, flu-like symptoms, body aches, and swollen lymph nodes. Also, rash with facial swelling, mouth or lip sores, eye redness or pain, and skin pain. And finally, rash with blisters, peeling skin, a rash that spreads quickly or involves the face, mouth, eyes, or genitals. The phrase I want patients to remember is rash plus fever, mouth sores, eye pain, skin pain, or peeling is not a wait-and-see situation. That is a get-checked-now situation. When in doubt, call the prescriber. If symptoms are severe, go to urgent care or the emergency room. Do not play detective at home with the serious rash. Google Images is not a treatment plan. The risk of serious rash is highest early in treatment, especially during the first 2 to 8 weeks. The risk can increase when the starting dose is too high. Other risks: dose increase too quickly, combining lamotrigine with valproate, a history of medication rash, or not following the titration schedule. This is why patient education is essential. Lamotrigine has rules, and those rules are not decoration, they are safety rails. Lamotrigine must be titrated slowly to reduce the risk of serious rash. A common adult titration schedule starts with 25 milligrams once daily for weeks 1 and 2. Weeks 3 and 4, 50 milligrams once daily. Week 5, 100 milligrams per day. Week 6 and beyond, 200 milligrams per day as a typical target maintenance dose. Now listen carefully. This dosing changes if you are taking valproate, birth control, or other medications. Do not memorize one schedule for everyone. The medication list matters a lot. Valproate can significantly increase lamotrigine levels. If someone is taking valproate, lamotrigine must be started at a much lower dose and titrated more slowly. Why? Because higher lamotrigine levels can increase the risk of serious rash. This is one of the biggest prescribing safety points. We must account for the interaction. Estrogen-containing birth control can lower lamotrigine levels. This means patients may need dose adjustments if they start, stop, or change estrogen-containing contraceptives. Birth control changes can change lamotrigine levels, so tell your prescriber before any changes. Do not let the medication list have secrets. Secrets are for surprise parties, not dosing. If a patient misses several days of lamotrigine, they should not automatically restart at the previous dose without calling the prescriber. Restarting too high can increase rash risk. Lamotrigine is not a swimming pool where you cannonball back into the deep end. If you miss about 5 days or more, you may need to walk back down the titration steps. Call before restarting. How long does lamotrigine take to work? Lamotrigine takes time. This is partly because the titration is slow. Patients often ask why we can't increase faster. Because we like skin. We are fans of skin. We want the skin to remain calm, attached, and not involved in a medical emergency. Slow and steady is the goal. Weeks 1 to 2. Low starting dose, watching for side effects. Weeks 3 to 4. Gradual increase. Beyond 6 weeks, assessing mood response. Steady is exactly what many patients need. How patients usually take lamotrigine. It is usually taken once or twice daily, with or without food. If nausea occurs, taking it with food may help. Patients should not stop lamotrigine suddenly without guidance, especially if taking it for seizures, as this can increase seizure risk or lead to mood destabilization. Take it every day as prescribed. Common side effects may include headache, dizziness, nausea, and blurred or double vision. Other effects are sleepiness, insomnia, tremor, and fatigue. Most side effects are manageable, but rash is the one that requires special attention. Rash is lamotrigine's red flag. When it waves, we do not say, maybe it's fine. We check. Lamotrigine can really cause serious hypersensitivity reactions, like DRESS. This involves rash, fever, and swollen lymph nodes, and can affect internal organs like the liver and kidneys. Like other anti-seizure meds, lamotrigine may be associated with increased risk of suicidal thoughts. Monitor for worsening depression or behavior changes. In the US, call or text 988 if needed. Rarely, aseptic meningitis has been reported. Seek medical evaluation for severe headache, fever, stiff neck, and sensitivity to light. It is rare but important to know. Families should understand that lamotrigine is often used as a long-term mood stabilizer. It is not meant to sedate the patient into silence or erase their personality. The goal is stability, fewer depressive crashes, better emotional steadiness, and improved functioning at work, school, and home. Stability allows the person to use their coping skills. Let's summarize. 1. It's a mood stabilizer. 2. Helps with bipolar depression. 3. Calms brain signaling. 4. Must be titrated slowly. 5. Report any rash immediately. 6. Review dosing. 7. Check interactions. 8. missed dose safety. 9. Monitor for suicidal thoughts. 10. Keep education simple. That is good patient education. Lamotrigine is not magic. It is not a personality transplant. It is a tool, and when used carefully and monitored appropriately, it can be very helpful. Thank you for watching. My name is Dr. Ben Osevwe, DNP-PMHNP. Join our mentorship family today at rotationmatchnetwork.com. Subscribe for more.